slides. So let's start with the choroidal thickness because this has been there with us for quite some time. And this is the picture showing a myope on the top where we can see the choroidal thinning and patient with AMD at the bottom. Again, the choroid appears to be much thinner.
Yeah, yeah,
And
yeah,
these are a typical picture of the
yeah, yeah,
thickened
yeah, yeah, yeah,
choroid
yeah,
where you can see that the choroid is thickened in a patient with CSR on the top, and the thickened choroid you can see in a patient with VKH at the bottom, where you cannot see the posterior border of the choroid, and you can see the undulation as well. We'll come to that later again. We worked to develop a algorithm for choroidal volume in 2013, and this is now it is pretty much available in almost all the commercial devices, where you can now get a choroidal thickness grid, as you can see on the left, as well as a choroidal volume with distribution in different sectors, as you can see on the right. Let's look at how are we actually using in 2020 the information which we get with choroidal thickness. As we were talking about the subretinal fluid, and if you have a patient with a shallow subretinal fluid, if the choroid is thick, then it is a CSR, and if the choroid is thin, you can confidently make a diagnosis of wet AMD in an old patient instead of CSR. Let's talk about the VKH and CSCR as we were talking before. As you can see, the choroid is thickened in both the diseases. You see the subretinal fluid in both the diseases, but the very characteristic, you can see that the uh, choroid in the picture on the top, which is VKH, does not show a good architecture of the choroid. You are not able to see the choroidal vessels so clearly, and I will come to that picture again when we follow up these patients with VKH. The When you have SRF is thick choroid, but you are still able to see the choroidal vessels, as you can see at the bottom in a patient with CSR, the choroid is thick, but the choroidal vessels are still seen. We worked on looking at choroidal thickness. We learned that, okay, choroidal thickness is more in CSR, but can we actually use this choroidal thickness as a predictor when you are treating these patients with CSR? And when I was in LVP, we looked at this data and we found that if you really have a subfoveal choroidal thickness less than 350, then it is pretty much a chronic CSR. And when you see a patient for the first time with a subretinal fluid with not much thickened choroid, say less than 350, that means this is pretty much a chronic CSR which needs treatment rather than observation, as you can see the pictures behind. Let's go back to VKH, and we saw this picture of VKH where the choroid is thickened and the choroidal architecture is not seen. And when this patient is treated with steroids, you can see that not only the choroid became thin, but now you are able to see the choroidal vessels clearly, which we are not able to see before we started the treatment. And this beautiful paper from Japan, which clearly shows that how the choroid is thickened in the beginning and it slowly comes down as you are treating this patient with steroids. And I believe what we are using now in our clinical practice is that we follow up these patients more carefully. And if we find an increase in choroidal thickness, then we suspect that this patient is having a recurrence before even the subretinal fluid comes in. And we should be starting these patients again on steroids and put them on some immunosuppressive just by following up these patients by looking at the choroidal thickness. What about the choroidal vessels? As we understand that the choroid is mainly made up with choroidal vessels, then why are we ignoring this? And this is something which Professor Sonada from Japan, who came up with the concept of choroidal vascularity visualization by binarizing these images. And I was in India at that time. We were working on automated choroidal segmentation, and I was trying to get this choroidal vascularity for the whole volume. And this is something which we worked on the whole volumetric data because I wanted to get the whole volume information, because choroid is a structure where you should be able to see the gross information, and the choroidal index is defined as the dark pixels divided by the total choroidal area. And this is something which we have been exploring much deeper to understand the choroidal vessels. And we went ahead and looked at multiple diseases ranging from myopia, AMD, CSR. But the question was that, are we actually able to use this choroidal vascularity index in our regular day-to-day practice, and how can we actually make this as a biomarker. And this is something very interesting, where I worked with my collaborators in Milan, where we actually looked at these patients with wet AMD, and we found that the CVI could be a predictor for AMD recurrence, because we found that CVI increased when the fluid was about to come back. So if you are following up your patients of AMD, and if you follow up closely by using CVI, you may be able to predict the AMD recurrence before you can actually see an obvious fluid on the cross-sectional OCT, structural OCT. And the similar way, we wanted to understand how the CVI could be useful when we are looking at the CSR patients. And this is the work in collaboration with David Saraf in Los Angeles, where we looked at the choroidal vascularity, uh, effect of PDT on the choroidal vascularity, and we found that the choroidal vascularity index could be a very good outcome measure and a predictor to understand whether your patient is responding to PDT or not, and if you can predict any recurrence by using this indices. Now we have come up with a new concept of choroidal vascularity map, where we can actually now put the ETDRS map on the choroidal vascularity, and we have been using this ETDRS map for many years for retinal thicknesses, and now we have an algorithm where you can actually have the choroidal vascularity in each of these sectors, and now we are exploiting this algorithm in understanding the GA progression and the Drusen regression, so we understand that which area will have a faster regression or the GA progression. This is an example from one of our previous recent publication, where you can see that this map is easily showing the difference between the choroidal vascularity of normal females, one of 34 years old on the left, and the 67-year-old on the right, where you can see the choroidal thickness map on the top, and the bottom shows the choroidal vascularity index. And these values, which I'm sure you're not able to see, but these values are actually the average mean of these individual sectors, and which is what we will be using in coming future. What about the wide field choroidal vascularity? Because now we can use the 55 degrees spectralis lens, where you can actually go almost up to the equator, as you can see on this image. And we were interested in understanding that can we actually see the choroidal vascularity index, and how does it actually change as we move to the periphery up to the equator. We could assess, and we saw that the choroidal vascularity, in fact, the choroidal vascular content, in fact, increases as we move to the periphery. And one more very interesting concept is that actually you go ahead and measure the individual choroidal vessels. And this is one of my papers from LVP, where we actually looked at the individual vessel layer in a myopic patients who were non-pathologic with 20/20 vision, and we found that there is significant medium-sized vessel thickness compared to their age-matched emmetropes. And this was something very useful, which we will be looking at in future. This is a very typical example of CSR, where you can see that the large choroidal vessel thickness in the outer part of the choroid is much thickened compared to the inner choroid. And this again explains the whole concept of pachychoroid, which I'm not going into the detail. What about taking this Heller vessel thickness to the wide field? And this is the work which we did with my collaborators in Italy, where we looked at the large choroidal vessel thickness up to the mid equator. And this is a very beautiful graph, where we published recently in scientific reports, where you can assess the large choroidal vessel thickness graphs very nicely, and you can see compare with the choroidal thickness maps as choroidal thickness up to the periphery as well. What about taking this work to the automated segmentation? This is some of our work which we published in 2018, and now we have the Heller vessel volume doing for the whole volumetric data obtained from the macular thickness macular area, and this could be very useful in understanding pachychoroid. I think on-fast scanning, and there was a nice question about the structural on-fast. This technology is very underutilized, and this is this provides us a very important information about the whole architecture, retina as well as the choroid, going all the depths, and you can actually play around with these scans and understand the changes. And we took the choroidal scans and we binarized these, and now we have an on fast vascularity where we remove the shadows, as you can see in the middle panel, where we have done the shadow compensation and removed the retinal vessels, and now we have on fast choroidal vascularity. And we use this algorithms in patients with CSC, and we learned that how the on fast vascularity changes from top of the choroid to the bottom of the choroid, and we are now using this technology in understanding the choroidoscleral border in these patients. Not to leave aside the choroidal hyperreflective dots, I know this is a new concept which is coming up recently, but I was interested in looking at these choroidal hyperreflective dots and what does it show. And we can see these choroidal hyperreflective dots in many diseases, inflammatory like toxo at the bottom image, the PCV, the AMD. But what does it actually signifies? Still, it is very minimally understood, but we are exploring this in various diseases. And this is the paper on choroidal hyperreflective dots in Stargardt's. And we were interested in actually going ahead and making the quantification of these hyperreflective dots. And we came up with an algorithm where you can actually measure these hyperreflective dots. And I wanted to use it for following up the CSR and AMD patients. And this is one of our paper which got accepted recently, which clearly shows that how the choroidal hyperreflective dots changes in patients with acute and chronic CSC, and we are exploring this in various diseases. This is an example of retinitis pigmentosa, and we aim to develop a 3D model of the choroid where we envision that we will be able to track down the vessels which are making the PCV polyps or the CNV complex. I hope we can achieve this soon. I did not get into the details of OCT angio using in choroid because the previous speakers have already spoken quite a bit. But I think the main utility is choriocapillary voids, early CNV identification, CNV quantification, and non-exudative and nascent CNV detection. So I will just conclude by saying that we have a lot of choroidal biomarkers which are coming up, and we are trying to get the quantification of these biomarkers so we can use it in our clinical practice. And I'm sure that we have a lot of work to do. At the end, I would like to acknowledge LV Prasad, where I did most of my work. And thank you very much for listening, and have a great day. Thank you.